And no one talks about it, but 1/3 of women have this embarrassing problem.
We'll have solutions all next on the Morning Blend. And welcome back. Well, doctors estimate that 1 out of 3 women in the U.S. develop some sort of pelvic floor problem. And the most common one is what's called urinary stress incontinence.
And Dr. Alexis Chesrow with the Center for Continence and Pelvic Floor Disorders at Aurora is here to talk about this common problem and solutions that can help. Good morning. Thanks for being here.
Good morning. Thanks for having me on.
I think one of the biggest obstacles with this particular problem is just getting people probably to talk about it to their physician or to somebody.
Well, what I tell my patients is everyone's aware of heart disease, and we know how common a problem that is in our nation. People spend more money on incontinence products than they do as heart disease.
Wow.
It's that common. So when women come in to see me, I try and put them at ease that most of their friends, aunts, grandmothers, mothers, they all have had experiences with this.
So there's lots of different types of incontinence problems, but the one you want to really focus on today is stress incontinence. What is that?
All right, well, it's nice that you led in with pelvic floor. So stress incontinence is a symptom of overall pelvic floor health, which is why it's so lovely that we have a pelvic floor center where we can address everything. But stress incontinence itself, think of it as almost a muscle weakness due to as childbirth, hormonal changes as we get older, genetics plays a factor. But basically, when you cough or sneeze or put stress on the bladder, that muscle down there can't hold the urine in anymore. It's just a plumbing issue. And it can be fixed. We have a lot of great options these days.
Is it something that women can fix on their own? Women are told to do different exercises for different reasons. Is it something that you can do to help with urinary flow too?
You can. All right, so the exercises everyone tries to do them, it's very hard to do them correctly on your own. The pelvic floor is actually this interlaced whole hammock of muscles. So the nice thing about our center is we have pelvic floor physical therapists. You see sports people on the TV, it is no different than a knee injury. Your ligaments, your joints, your muscles get out of whack, you see a physical therapist. I send my women to physical therapists all the time. It can get them markedly drier. And I'm a surgeon, and it keeps them out of my hands.
Wow.
It's really nice.
So it's not just as easy as doing Kegel exercise, which is what a lot of people think of when they think of doing exercise.
You can actually do those incorrectly and not get any benefit. And I have women who have been Kegling for years, and then they see my therapist, and they're like, oh.
That is not what I was doing.
That's not what I was doing at all.
Okay, so the problem is, if you're having stress incontinence, some of the symptoms or issues you would have are what?
So what I tell my women, they're like, well, I have incontinence. When do I need to do something about it? And I say, when it's keeping you from doing what you enjoy. Is it keeping you from going out with your friends? Is it keeping you from exercising? Is it keeping you from picking up your grandkids? Come talk to me then, and we'll figure out things to do. And the main symptom is, with activity, urine leaks out. And people will even, it may be a few drops in some people it actually soaks their clothes. They get a cold and they can't leave the house.
From the coughing and sneezing.
From the coughing and sneezing.
Okay. So for people who wonder why it happens, you talked about childbirth, hormonal changes, a weakening of that muscle, and some people probably can be even doing Kegels right and still can't fix the problem,
Absolutely.
right? So what are some of the solutions then?
So once we get to the point where it's interfering with your life and Kegels just aren't enough, we actually have a test. Just like you can do heart tests to see how well the heart functions, we have a little test we do in the office to see how well your urethra functions. And we can give you a pretty accurate estimate of how bad your incontinence is. And trust me, the women come in, they're like, I told you it was bad. And then I do the test, I'm like, congratulations, you were right. You are, this is how science says how bad you are. And so there's 2 options at that point for what we can do. And I describe them as, we can either do injectables, it's not as bad as it sounds, which brings the urethra together from the inside, or we can do a sling procedure, which supports the urethra from the outside. And there's plus and minus to each. But the injectables are fantastic for people with mild to moderate incontinence who are very active. We do it in the office. You don't have to not eat or drink. You can go home that same day. It takes 20 minutes, and you can go back to your normal life.
And how long does that last?
It can last a couple of years, actually.
Wow.
And then we can re-inject thereafter. And so it's a pretty painless little 20-minute procedure.
What I think is great is that people who visit, and the full name of it is the Center for Incontinence and Pelvic Floor Disorders at the Aurora Women's Pavilion.
Yes, ma'am.
It's located in West Dallas. It's a long name, but what I think is great is that people who have any, varying degree of this type of problem can come, be assessed, talk about their symptoms, talk about solutions, which is a great place, I think, where everybody understands what you're talking about, and there's no reason to be embarrassed either.
Well, the pelvic floor is complex, and usually you don't get stress urinary incontinence in isolation. Sometimes we do, but it's a whole spectrum. So we have the ability to address everything that's going on and steer people accordingly. And we're very lucky that everyone who staffs there is fellowship trained. So it's a real great resource for the community.
I think it's wonderful, and I have a feeling that there's a lot of women listening today that will be contacting you for some help. So here's the information that you can use to contact Aurora Women's Pavilion in the urinary and incontinence area. It's 414-766-9050, or visit aurora.org/incontinence for more information. Thanks for being here, Doctor.
Oh, my pleasure. Thanks for having me.
Thank you.